Hello. So I'm back for week 7 of the student series for field work in a hand therapy clinic. And I would say that this week was more challenging for me. I don't really know why, honestly. And I think that there's sometimes where that just happens. You're just having an off week. I know some of my friends, we all were kind of saying like, it just feels like a weird week, like a kind of like an off week. So I feel like maybe this week was just not my week. But I think in terms of what I've been doing, I've been doing a lot more treatment. So I'm kind of having my own caseload. I've been working with some of the people that I've worked with previously, and then I've also been adding in people that I've evowed as well. And then there's some people that Steph's worked on a little bit more that I have started to work with. So that makes it nice as well to be able to see a little bit about what she does because it's still something that's very new to me in terms of this type of setting. Hand therapy is very specialized. So in terms of different interventions and different strategies to look at a certain aspect, I would say that it's interesting to be able to still see like all the different things that Steph brings into the treatment session because, I may think of one thing, but then she thinks of a million things. So it's interesting to see that played out. And then after you see something, you're like, oh my goodness, like that's a really good idea. Like you can work on extension, flexion, radial abduction, um, palmar abduction. You can work on ulnar deviation, radial deviation. You can work on a lot of different things all together. So I think that that's neat to sometimes you need to see that happen, at least for myself. I need to see that and then be like, oh, I see where it's working on all of these different things. Whereas sometimes for myself, I need to go, look in the closet or look in our storage area and be like, okay, I want this person to work on, let's say, wrist extension. So then I need to, a lot of times for me, I have to think of what I need to get or what I want them to get out of it and then look for things like that. But it's also interesting to look at it the other way when you see the exercise and then you're like, okay, that works on XYZ. So I think that that's kind of neat to be able to see. And I think that that's part of where I struggle the most right now. Making sure that I vary things in treatment. I know Steph and I've talked about that. Uh, Making sure that, you're not doing the exact same thing every single time. Or I understand, like, there's some things that are be like strengthening wise, you might do similar things every time, but, make sure that if they have kind of, reached their max for, say, the flex bar, okay, well, can they go to the next level? Um, so it's just things to make sure that you're aware of. I would say that I'm still having some trouble with treatment planning and then also just notes every now and then I have issues with. But I think that's pretty much to be expected. And then I would also say that let's see here. I know for me personally, confidence is a big issue. I say big issue. It's not really a big issue, but it's my one of my main issues. Um, I just second guess myself a lot, and I think that at least my thinking is a lot of as a student, if you are a high achieving student, want to know things and you want to be able to be like, okay, this is it. And then, there's times where I've been like, oh, I think this is a great intervention. I think I'm going to do this. And then stuff's like, and I'm like, yeah, you're right. You're right. Because she'll ask me, about why I'm doing it. And then as I'm talking it through, I'm like, oh, that's probably not the greatest decision. Um, and I think that those times are good because I need to know, like, obviously, like, okay, that's not something that I should work with that individual. But I also think sometimes I struggle to just pick something and do it. A lot of times I'm like, oh, like I'm hesitating and I'm like, oh, Steph, should I do this? Should I do that? And I think that she wants to see from me that I'm just going to, you know, act like I'm confident and be like, this is what I'm going to do. And if it's wrong, it's wrong. I hope it's not wrong, but if it is, it is. So I think that that's something that I really need to work on. And I'm sure that other students probably feel somewhat similar in terms of, when you have someone who has so many years of experience, is so knowledgeable, and then you feel like you basically never went to school when you're there. So I think that it's a normal feeling and it's something that you just have to work through and keep going and being like, okay, well, if I'm wrong, I'm wrong. I'm going to move on from that and learn from that. And I think a lot of things is also taking the any bits of information or any bits of advice that you get, putting that in your mind and being like, okay, last time I did that, she said about doing this instead. So I'm like, okay, well then I'm going to incorporate that. So making sure that you're using the information that you're getting from your supervisor and being like, okay, this is what I need to do the next time. So I think that that's all part of that learning process. And despite being in week 7, I guess I'm past the halfway point now. uh you are still learning constantly. You're going to be learning for a long time. I'm going to be learning for the rest of my life. But just remembering that, I know I'm past the halfway point, but that doesn't mean that I'm still not going to know things. I'm not going to know a lot of things. So just keep being a sponge and enjoying the experience. I'll see you for week 8.